Chronic fatigue can be a truly debilitating condition with an enormous impact on your life. It is by far the #1 symptom patients present with at our clinic. Fatigue leaves so many people barely surviving one day to the next when they should be thriving and living life to the fullest. I had a patient just the other day, 35 years old, who was unable to go to her son's ball game because she had absolutely no energy and couldn't pull herself off the couch. This is no way to live, and so many people are experiencing this every single day. To make matters worse, our traditional medical model has very few legitimate answers to offer anyone struggling with chronic fatigue. Much like IBS for digestive issues, fibromyalgia and chronic fatigue have become catch-all diagnoses for people who have chronic fatigue, but their doctors have no idea why. While the root causes can be challenging to uncover, there is always a reason for the symptom. It is not in your head. It is not because you're getting older, and it is definitely not a deficiency of an antidepressant. So I wanted to share the top 4 sources of chronic fatigue that I see in my practice that conventional doctors often overlook. So let's walk through them to help you see if they may be playing a role in your chronic fatigue. #1 is going to be mold and mycotoxins. It's not nice to think about, but mold is a lot more common than what most people think. And just because you can't see mold doesn't mean that it isn't there. The particles are typically too small for the eye to actually see, and it's often hiding behind walls, inside your air vents, in your furniture, in your carpets, in clothing, and even in your food. Mold and the toxic gases it releases, also called mycotoxins, attack your immune system, attack your nervous system, and your brain, which is why fatigue is one of the most common symptoms of mold illness. One study looked at 112 people who were diagnosed with chronic fatigue syndrome and found that 93% of them tested positive for at least one mycotoxin, compared to 0% in the healthy control group. Beyond fatigue, mycotoxin exposure can lead to a whole host of symptoms, including confusion, difficulty concentrating, coughing, difficulty breathing, headaches, muscle aches, digestive issues, and many other problematic symptoms. This can make it really hard to pinpoint, especially because the symptoms overlap so many other conditions. Add on to that the fact that conventional medicine barely recognizes that this condition, chronic mold, even exists. So they rarely test for it or ask about it, but it almost always goes undiagnosed. #2 is going to be Lyme disease and co-infections. This is another big one that gets missed by many doctors because their diagnostic criteria is way too narrow. Contrary to what you may have heard, Lyme disease doesn't always present with the classic bullseye rash, and basic conventional tests often don't pick it up. What's worse is that new cases of Lyme disease are being reported at rates that are 10 times higher than what the Centers for Disease Control initially predicted. Plus, most people and most doctors think that Lyme is an acute, short-lived sickness. You get bit by a tick, you get sick, you take antibiotics, and you're better forever. In reality, a lot of people develop chronic persistent Lyme either because it doesn't get diagnosed and treated, or because it isn't fully treated and you're left with lingering symptoms. If you live in an area like I do where Lyme disease is very prominent, some of the symptoms you want to look for are fatigue, migratory muscle aches, and joint pain that moves around different locations in your body. That is classic. Headaches, memory issues, numbness and tingling, and a variety of other bizarre symptoms, which is why Lyme disease is called the great imitator. It imitates so many different diagnoses. Lyme disease is often accompanied by what are called co-infections, which can be just as problematic and more times than not get overlooked. Bartonella, Babesia, Mycoplasma, Rickettsia. These are just a few of the many tick-borne illnesses we see in patients, all of which can cause fatigue. #3 is mitochondrial dysfunction and nutrient deficiencies. Your mitochondria are the power plants of your cells. Their job is to convert nutrients into energy. So as you can imagine, if they're not functioning at an optimal level, your body won't have enough energy to fuel you. The cause of mitochondrial dysfunction is often nutrient deficiencies because your mitochondria rely on specific nutrients, including CoQ10, B vitamins, L-carnitine, magnesium, and a bunch of healthy fats, among other things. So you have to figure out what nutrients you're actually deficient in to make sure you're fueling your body and fueling your energy. Number 4 is thyroid dysfunction. Fatigue is also one of the first signs of a thyroid problem. Your thyroid hormones control how your body uses energy. So if your thyroid is underactive, as is the case with hypothyroidism or Hashimoto's, you can experience the symptoms of fatigue, brain fog, weight gain, hair loss, and constipation. So I cannot stress enough how important it is to get the right testing so you can get to the bottom of what is causing the chronic fatigue in the first place. Some of these root issues are pretty serious and take intensive treatment protocols to overcome. Mold and Lyme in particular are some of the most complex cases that will often set off a cascade of other conditions and symptoms. So you need to take this treatment seriously and get on it as fast as possible. The sooner you get the right testing to identify the root cause of your fatigue, the sooner you can get on a clear path to healing and restore the health and energy you once knew. My name is Dr. Seth Osgood, and I'm the founder of GrassRoots Functional Medicine. Our patient-centered approach, combined with our comprehensive testing and true partnership, has helped so many people overcome complicated illness and debilitating symptoms. Life is too short not to thrive, but to reclaim your health and wellness, you have to take control of your health. If you're ready to finally get real answers and lasting solutions, we'd love to work with you and figure out what is going on. Just check out our adaptation program and schedule your free 10-minute consult with me, and together we'll review your history, we'll discuss your goals, and most importantly, we'll figure out if you have the right mindset and the motivation to be a good candidate for our adaptation program. Again, my name is Dr. Seth Osgood, the founder of GrassRoots Functional Medicine, and I am looking forward to speaking with you soon. I hope you have a blessed day. Thanks again.